Well, welcome. Welcome to our first podcast at ODH. We're calling it Healthy Perspectives with Dr. Bruce Vanderhoff, and I'm Dr. Bruce Vanderhoff. I'm really hoping is that this is going to be a useful platform, a platform where we can discuss a variety of issues that affect Ohioans all across the state, and an opportunity for us together to develop a deeper understanding of various issues that are impacting our health. And so what I'm really looking forward to is having good, informative discussions of these topics. Now, our first topic, I think very appropriately, is what is public health? And we've chosen that topic because I'm really not sure that everyone really grasps what it is that we do in public health. And just thinking about definitions, I think the CDC really does offer a pretty good definition. And their definition is public health is the science of protecting and improving the health of people and their communities. And so as I thought about this being a discussion and thought about, well, who could help us with that discussion, my mind immediately went to our guest today, Jim Watkins. Jim is recently retired after 18 years with the Williams County Health Department here in Ohio. And he was, for 18 years, their commissioner and has a total of 37 years in public health service. So really, who better to help us explore this important topic? What is public health? Jim has contributed to public health in Williams County in so many ways over those years, not the least of which in terms of assuring that the community has the funding it needed to be able to pursue its mission. And he spearheaded the passage of a levy in 2010 that really set the department on a positive course. And now that he is retired, he has not left the public health world. He hasn't left that scene. He is continuing to make contributions to the development of public health and especially its future as an adjunct instructor at Bowling Green. So it is just a real pleasure to welcome him to this podcast. Welcome, Jim.
Thank you. I appreciate the opportunity to have a discussion with you.
Well, let me just begin with this. You know, as an individual who has, a really strong background in public health, I am just so pleased and intrigued by your decision to continue that commitment by teaching. And so could you just share a little bit about this new endeavor and what you're doing? And just real briefly, why did you choose to do that?
Well, I think clearly this has been a passion for me for some time. From that standpoint, I really want to impart on our younger generation the importance of public health, because I think that it is the linchpin of why our societies are able to function the way they do today. And so I think that for me, being able to perhaps encourage folks to go into public health, I think is important to me, because I know for me it was a very rewarding career. I think it's an opportunity for youth to give back to society, to make our society better. So for me, it's a very strong push that I have. So at BG, I've this last fall co-taught a class on emerging infectious disease. As you can imagine, that was a lot of fun with some of the things that we've gone through in recent times. And right now I'm doing one on environmental sanitation that, being able to impart to them some of the things like John Snow, what he did in resolving the issue of cholera in London. And we take all of this stuff for granted, but it's important that we understand that history of where we came from and why we're able to function the way we are today.
So, Jim, imagine for me that one of your students approaches you with this question and says, "Hey, what is public health?"
Well, I think that what public health to me symbolizes is it's a community working collaboratively to make sure that the infrastructure is there, the processes are there to ensure that we can live the healthiest possible life that we can. And we do that cooperatively with the community. So I think that's one of the things I really enjoyed about public health, or still enjoy about public health. It's really that cooperation between the government agency, the business community, the elected official, and the general populace to see how can we work together so that we can live healthier, longer lives.
Yeah, I think that's really well said. As I think about what you just said, but when I think about the definition that the CDC offered, it really causes me to reflect on, well, what about the work that we're doing at ODH? And I'll tell you, I think many people would be very surprised at just how broad our work is, and how many partners we not only have, but need in order to realize our mission. And so, as I think about our bureaus, we've got our Child, Maternal, and Family Health Bureau that handles a number of very important programs, WIC, our vision, our dental programs. We have environmental health and radiation protection. And the work they do ranges from work helping to protect children from lead exposure, all the way through the regulation of private water systems to safeguarding people from radiologic exposures. We have infectious diseases as a bureau, and you can imagine the breadth of what we do there. Health improvement and wellness, that includes things like tobacco cessation and programs to reduce cancer and chronic disease impact. Health preparedness, which helps us assure that Ohio and its communities are ready to deal with emergency events, and we've certainly had a number of those, including natural events like tornadoes here in Ohio. Our survey and certification bureau that licenses and regulates hospitals and long-term care facilities. Vital statistics. If you need a birth certificate, guess what? That's the Department of Health. And we also have, and many people may not realize this, a pretty extensive and robust public health laboratory that serves the entire state. And then we spend a lot of time and energy working on collaboration with our 111 local health departments, your health department having been one of them. So as you can imagine, doing all this, we really rely on our partners. And it's a very interesting mix of medical scientists working with people who understand how to work inside of communities and understand community needs, as well as people who understand government, both at the local and the state level. So it's really kind of a fascinating mix, and much broader than I think a lot of people would appreciate. One of the things, though, that really has struck me during my time here at ODH is, though, how important our partnerships are. Certainly our local health departments are among our chief partners, but we have lots of partnerships that go beyond that. Jim, could you talk a little bit about, with your many years of experience in public health here in Ohio, and particularly in Williams County, talk about some of those partnerships that really made the difference in public health, and some of the challenges that our local public health departments face, particularly in partnership with other people. What are some of those challenges that you really rely on those partners to help you address?
Well, I think you're hitting on, to me, that's one of the main features of public health is that partnerships are crucial to public health. I don't feel that we can accomplish our goals if we don't have that collaboration with the community. And because there's so many aspects of what we're attempting to do, especially around the areas of chronic disease, where we're trying to make community change, that really involves people making decisions that are going to change the trajectory of health for the community for many, many decades. So I
Yeah.
think that from that standpoint, that's super important. I think of when we have had different events, we generally partner with other community members. We need the community to be a part of the solution. They're part of it that gets the work done. So I think that that's super important. I think one of the challenges you have can be that people get territorial. And so I think that that's another skill set that I think that as local public health folks you need to develop is how to partner. Partnering is just not happening by itself. It's navigating that and getting people to feel that we're all in this together. We're not in competition with each other. We're all trying to go for the same goal. So I think, to me, that's one of the features that's super important. And one of the things we always try to do is make sure that it wasn't the health department, it's the health department working with the community.
One of the types of collaboration that has really stood out for me as illustrating just how effective our local health departments are at partnering with other agencies, partnering with organizations in their community, partnering with local government, have been responses to emergencies, and we've had a number of them. I think people are aware of the East Palestine train derailment in 2023, the Logan County tornadoes early last year, Springfield, and the challenges that their health delivery system was facing this past summer and fall. And those responses really, to me, brought out the strengths in those communities, even as they were grappling with challenges. Jim, can you reflect on your experience over those many years that you've served, and just share a little bit about how you've faced challenges in the community and how, as a local health department, you've been able to be a bridge and a convener and a collaborator in helping to bring about the best community response to whatever it was that you all were facing.
Sure. Well, I think for me, the easy one to bring out would be the last pandemic with COVID. That was something to really navigate, and it really involved us working with our business community as well as elected officials and other organizations within the community. When I think back with our vaccination clinics as an example, when we needed volunteers, we needed help, all of those partners came together to help us with that. And that didn't just happen. It's because of all the small things where we collaborated with our community over the years. We were a trusted organization within our community. And I think that's when crises happen, that trust we've built up over the years has helped us immensely. So I think that's that's probably the biggest thing that we strove for, was to make sure that we were a trusted entity
Yeah.
within our community.
Yeah. Yeah. As I think about what you're saying, the example of vaccinations really resonates with me. In the news now, we're hearing about major outbreaks of measles among largely unvaccinated or undervaccinated people. And I think it's easy to forget that we've also relatively recently had a measles outbreak right here in Ohio. Late 22 into 23, we had 85 measles cases, 36 hospitalizations, and again, this was among unvaccinated people. It really just highlights how important our childhood vaccines are, and reminds us that these childhood illnesses, which can be very severe, measles lands a lot of people in the hospital, and sadly, it has historically always been associated with a certain death rate. It really reminds us that we do have important work to do there. Jim, could you share a little bit about, as you were working with your vaccine clinic in your community, what were the messages that really resonated with people? How were you most successful at connecting with parents and families around the importance of vaccination and having that risk-benefit conversation?
Well, I think with us, with anything to do with vaccines, we always try to lead with empathy. Listen to people, allow space for questions and conversations, and try to acknowledge that they may have concerns, and just leaving that open door to have that opportunity that they feel like their voice is heard. I think that's an important aspect, is that you need to do those types of things so that they don't feel they're being bullied, because they are legitimate in having whatever concern they might have. And it's just something we need to make sure that we don't hold judgment against people. I think that to be successful, you have to listen to people. And I think that's one of the things we tried to do. We tried to listen to concerns and try to address them as best we could.
Yeah, yeah. No, I agree with that as well. Hey, Jim, so thinking about some of these topics that we just hit, can you share your experience of what is the role that the Ohio Department of Health plays in helping Williams County or any local health department do its job, be effective? For folks who might be listening and really don't know very much about, well, what is the Ohio Department of Health actually do? I know I heard Dr. Vanderhoff run through a whole list of bureaus they have and topical areas they cover. What does that actually mean in my community?
Well, I think it's difficult when any entity or individual is far away to really understand the backbone of what's supporting the local response to anything, or attempting to resolve something for the community. But I think that's the role of ODH, that you folks have always, in my experience, even though we don't always agree on things, it's okay that you've been there for us. You have helped us to understand maybe the reason for maybe why certain things need to be done a certain way, or that expertise that we don't have in a local health department. We only, in a health department, can only have so many staff and so much expertise. And ODH has been that entity that when we have questions on certain things, that we can go to you. I can think of situations where we would reach out to ODH. Maybe it wasn't ODH that was going to be the one to help us with it, but you got us in contact with people that could help us. And that's I think that we neglect to give the credit where we need to in that situation sometimes. And I think I truly appreciated the collaboration we had with the Ohio Department of Health.
Well, thanks. It means a lot. And I'd sort of reflect that right back and say the same from the ODH perspective. I don't think people realize that our local health departments really are public health in their communities, and the Ohio Department of Health works to support and empower those departments. The Ohio Department of Health, while we are distributed across the entire state, we don't have the kind of presence in communities that our local health departments have. And so what I've really appreciated about working with local health departments and visiting them and talking with them, but especially working with them is just what you described. It's the back and forth. It's the conversation and the real feedback that they're able to provide about what their community needs in a given situation or moment. And sometimes, as I think you alluded, it involves some crucial conversations. It involves some, now, hey, look, ODH, I know you're trying to help us here, but there's this piece over here that's missing. And then it's our job to say, oh, okay, didn't know that or didn't realize that. Let's figure out together how we can get that piece filled in. And you're right. Sometimes it really does mean ODH working as a bridge to another agency or another entity that might be the best agency or entity to supply that need. But our role then becomes that of a bridge and a helper in making that connection. So I really do appreciate, Jim, what you and your colleagues do, not only in helping us deliver in any given situation, but helping us deliver in a way that is really responsive to the unique needs of all the communities that we serve. So thanks again for doing that. Hey, as you're thinking now, as hopefully you have a little more time to think, especially now that you're, a instructor at a major university, tell me a little bit about sort of how you're seeing some of the opportunities that we have, some of the things that you're feeling really good about the potential for us to lean into. And, we've got this challenge, but I'm really feeling positive about the potential for us to do something about it.
Sure. I think, naturally in public health, especially when it comes to children's health, adult health, a lot of times the intersection there is with the medical community. And I think that one of the things that we have a real opportunity with is to work with the business community to kind of just share back and forth so that there's an opportunity for them to understand where our perspective's coming from, us to also hear from their perspective. I think that the more that we interconnect with maybe what in some ways has been non-traditional partners, in some ways, I think that that's a real opportunity that I think that we should lean into, because I think their involvement, their understanding is helpful to both of us to make improvements for our community.
Yeah, I think you're right on. In fact, it brings to mind an example for me that we're working on right now. Governor DeWine, in looking at the challenges facing young people in Ohio, and particularly with his really strong belief in doing everything we can to support kids in their development and their learning, ask the question, hey, how are we doing in terms of assuring that if we want kids to learn, if we want them to be able to read, we want them to be able to develop the skills they need to head into adulthood and be as successful as they possibly can be, what are we doing to make sure they can see in the classroom? We formed a strike force and we examined all the data and discovered there is an awful lot of opportunity there. We of course, have for many, many, many years screened our school-aged kids for vision problems. But as it turns out, the vast majority of those who are screened, and the screening says they need a more comprehensive exam and they may need a pair of glasses, don't get either. And that's pretty alarming. That's pretty troubling because it means that we've got an awful lot of Ohio's kids who are not getting the best opportunity to be successful in school and be as well prepared as possible to enter into their adult working lives. So what do we do about that? And the answer, of course, comes at many levels. The governor has introduced into his budget a request for funding for a program that is called Ohio C that would enable every kid, K through 3, to get that follow-up exam, get a pair of glasses if needed. But it's the how that is so interesting to me because delivering on that has and will require community wisdom, engagement, if we're going to be successful. And if we get the opportunity, we will be. But the reason we will be is because there have already been local community efforts that at a smaller level have shown the way. They've been successful. They've been able to cobble together philanthropic support and funding to help some of our kids get exactly what they need. And if we weren't engaged in conversations with local communities, learning from them, exploring with them what they've learned, we wouldn't know the path forward. We wouldn't know that there were examples, and we wouldn't have a model that could be applied at the entire state level. And I really can think of very few things that we could do in public health that could be more meaningful or impactful than ensuring all of our kids get the opportunity to see as well as possible so that they can be, successful at learning to read, write, and learn arithmetic. And the fact that we know that we're not doing a good job in that regard right now is just a really compelling public health story to me. In a way, you've kind of pointed toward something that is probably the best example that we could have come up with of what is the role of public health in our everyday lives and in the lives of our communities. So thank you. And I didn't even set you up for that, Jim. You came up with that on your own. So it shows that your many, many years of experience in this field you have had a real impact and that you've got real knowledge and wisdom there. So, well, Jim, we're getting close to the end here. Want to thank you again for your time and sharing your many, many years of experience. I have found you to be a indispensable resource in terms of your knowledge and experience in public health during my relatively short time here at the Ohio Department of Health. So thank you for all of that. I thought I might just close with, do you have any final comments or thoughts that you might want to share?
Yeah, I just want to say I appreciate the opportunity, and I think that over the years, the collaboration between the Department of Health and local health departments has certainly improved, and really appreciate that and hope that that continues into the future.
Thanks so much, Jim. Thank you.